Hey guys, how you doing out there? This is Dr. Lewerenz at Longevity Health Institute. At the end of my day here and back in Rochester, Michigan. Recently, if you follow me and subscribe to our channel, which I hope you do, so that you get educated and you get cutting edge information all the time in a personalized, functional medical wellness way to keep preventing illnesses and that. I just got back from Nashville, the clinical application scientific initiation, which is basically looking at how scientifically we, the innovation scientifically that we use in a clinical setting, a lot of functional medicine, personalized medicine. So CASI is put on by Designs for Health and a lot of excellent physicians. And, we talked about, and if you saw some of my videos, I met some great other physicians. Talked about some clinical applications of some cutting edge new stuff like delta tocotrienol, which is a certain type of vitamin E that is not only good for insulin resistance and losing weight and fatty liver disease, but it's actually shown benefits with ovarian cancer therapy. It's in a clinical trial right now, a stage 2 clinical trial, and learned about a lot of applications with hemp and CBD oils and the medical benefits of that. Actually ran into a few practitioners that are really doing a lot of cutting edge stuff with innovations with science and technology and artificial intelligence related to precision medicine, and really got a lot of the newer cutting edge scientific things that are out there, like herbs that are currently being used and studied. And then also listen to an excellent lecture. And you should look this guy up and follow him on YouTube. And he has a wonderful podcast with Joe Rogan that his name is Colin O'Brady. And Colin actually is the first human being that did a solo, unassisted trek over 1,000 miles across the Antarctic. First human being to ever do that. Several have attempted it. He's also climbed all 7 peaks in the world. He's a mountaineer. Great guy, great story. Really inspiring to literally know that you can set your goals and set your, what he calls Everests. What's your Everest for the day, for the week, for the month? And keep going forward, learning things, being in a positive direction, and you can thrive, like I always say. I want to go over something, though, that's really critical, that's just been on the news the last few days, and that is the carcinogen effect of Zantac. And I'm sure you've heard of this, or if you haven't, how Zantac, the antacid that's on the market, that's been on the market for decades, that actually helps kind of alleviate heartburn and digestive inflammation and indigestion, and acid reflux and such, how it's been linked to cancer, and it's being called a potential carcinogen, and I'll tell you why. But even CVS has recently just pulled it off the shelf, and it's also, this is on the tails of some other effects at NDMA, which is a byproduct, an organic byproduct that was found even in some blood pressure medicine that was made outside the country, and that's known to be a carcinogen. So if you don't already know this, get off your Zantac, because there is a potential increased risk of being a carcinogen, especially to the GI system, liver and gut and colon. So what is it? What was the cause? Well, it was caused by a byproduct in it called NDMA, nitrous dimethylalamine, or NDMA. It's a byproduct. It's actually an organic compound in tiny, minuscule amounts. It's found actually in foods. But NDMA actually is one of the reasons why we shouldn't do a lot of barbecuing and charring and curing and over grilling, which is, a summer habit that we all love to do and enjoy. But when you actually get that kind of burning effect to especially an animal product, you actually can create NDMA amounts, and that is known to be then a carcinogen. So that's something to avoid too, because you always are what you put in your mouth, right? You are what you eat. It's real. But anyway, in Zantac, that was found trace amounts, and actually at amounts that were not considered safe. And in their studies, actually, it was reviewed that it was a big enough concern to not only put a bulletin out, not only put a put out there in the media, but CVS and such to literally say, hey, we need to pull it off the shelf. I also have another thought about it in this, and I want to cover something else with you. Is you hear me talk about this all the time, but I don't find it that coincidental that that product, okay, is alleviating some gut symptoms and digestive issues, and yet a byproduct in it is actually something that NDMA causes cancer. Well, your digestive system is your immune system. You know, it's over 70%, 70, even 80% in studies show that it is your immune system. You have to have a good gut to have a good immunity, to be able to fight infections and fight off autoimmunity. In fact, actually at CASI, at that Nashville conference I was at, big talks were on autoimmune disease and gut health, and how the modulation of the digestive lining and leaky gut, this old term that was created literally decades ago by Jeffrey Bland and some of these pioneers in health and prevention and functional precision medicine, is that, you know, your gut is your immunity. You can't ignore that. And then here's this drug Zantac that has been shown to like be linked to cancer and being a cancer causer. So I don't think it's coincidental though that what was that drug meant to do? And it does is block acid, give you some symptom relief, a Band-Aid for your gut. And if your gut's not good, you're going to have in general lower immunity. So you're going to have a higher risk of cancers and autoimmunity. So you have to remember not just getting off of Zantac, but let's fix your gut. And I want to explain how to fix your gut in a very simplistic way, and I've covered this before with you. So not only you as my patient and potential patients or future patients, but I want you to share with others this information, because it's going to change and make a huge difference in their life and their immunity and alleviate any potential risk of cancer. But it's also going to do this, and this is the big one. They're going to feel better, and very likely they're going to lose weight, and very likely they're going to thank you. And that's what we are passionate about in doing, is fixing you, okay? Fix your gut, get well, you'll be well, and it's all about that in functional medicine, getting to the root cause, okay? So let me tell you how you're going to do this. And this is, I'm going to make it really simple, because this is the basis of alleviating, at least getting started on fixing digestive health, okay? If you don't do these parts and all of these parts, you will never get to a resolution of digestive health and a higher immunity and essentially fixing leaky gut. Now, obviously, in a personalized way, you might have to see a practitioner and be evaluated by blood or stool or live blood, besides a symptom evaluation or food sensitivity allergy testing. We do all this. But I'm going to give you the nuts and bolts of basics that you have to think about and do, okay? Now, in that, I'm going to cover a couple things. I'm going to cover some supplements that we often use, and I'm going to move you over here a bit to these supplements. And these supplements here, I use a lot. You can actually, when we're fixing gut and alleviating digestive symptoms, and I'm going to tell you why we use these particular ones, but I'll also tell you how you can get them. So to start off, you can get any of these gut fixing supplements on our website through our supplement shop. So if you go to our website, longevityhealthinstituteinc.com, and go to our website, go to the supplement shop and log in there. Our password is health, just like it sounds, HEALTH, and you will get linked. And we have a fulfillment company that works with a multitude of supplements that are all professional medical grade, all certified GMP, so that you can get the results you need and deserve. And these are the supplements that we use in the basis and the basics, of fixing your gut, okay? So we always use a good quality high dose probiotic, multi-strand, live, individually packaged, that's certified GMP. We always use glutamine. It's a regenerative amino acid. If you don't use glutamine, you won't regenerate your epithelium and your mucosal lining. that is protective to your gut. You need always glutamine. I very often, though, initiating for 2-3 months a patient, I'll put them on IG26, which is an immune protein powder. These are both powders. You can mix them together, put them in smoothies, etc. These will help regenerate the cellular lining and help augment your immune system. They're very soothing to the gut too. A lot of people within even days to a week or two, they will say that their acid, their symptoms calm down. This is a unique probiotic called Saccharomyces boulardii. You don't need a lot of this and you don't need it very long, but Saccharomyces boulardii is a unique strain that is excellent for candida and yeast and builds up your gut flora, which is the epitome and paramount to fixing a gut. You got to get rid of the yeast, okay? Saccharomyces boulardii with a multi-strain probiotic, you may need probiotics for a year. We'll see. That all depends on seeing a practitioner, a functional medicine doctor that can give you the nuts and bolts and the precision of what you might need to cap it off. But these are the basics. Saccharomyces boulardii I often have to use for anywhere from 30 to 90 days. I'm actually currently formulating a very special probiotic that's going to have multi-strained live high dose of probiotics in the 35 to 50 billion count, but with Saccharomyces boulardii in it so that you don't have to take extra, okay? But again, a good probiotic, high quality, live, certified, medical grade, glutamine, immunoglobulin, and occasionally you need some Saccharomyces boulardii, okay? Now, what do you need also? I'll bring you back here so you're not, or I'm not so strained. What do you need also, though, to fix your gut? You have to be gluten-free. You have to stop irritating the wound of your digestive lining. Gluten has enzymes and protein in it that are actually very irritating to the gut lining, no matter what is going on. So everybody, to start healing a gut, needs to be gluten-free. Dairy is also very essential because dairy is hard to break down. It's a high-fat, high-protein substance that we lose enzymes as we age that is hard to break down. So gluten-free and dairy-free are at least the basics, regardless of allergy, sensitivity testing, etc., to start not irritate the gut wound. You need some of these products to heal the lining, treat the candida, okay? And this way you're getting some resolution, not just of symptoms, but actually healing the epithelium of the lining and not needing Zantac and not having carcinogen and cancer risks. And that's what's key. Fix this problem. You reduce not even medications, but then risks of, contaminants in medications like NDMA, okay? And you get to the root cause. So get off your Zantac, do a functional medicine fix, always works, okay? And be well. Hopefully this is informative. Again, our website where you can get all this stuff and other wonderful things is longevityhealthinstituteinc.com. Go to our supplement shop. The password is health. We have a fulfillment company that ships within days. There's even free shipping that's available. So in any questions, you can always message or email us directly at our office or just give us a call, 248-289-6643. And we also have an 800 number that's online. So this is Dr. Lewerenz, always bringing you the best in functional integrative primary care. We'll be coming at you again soon. Share this with others. Subscribe to our channel. Okay, and keep being well. Have a good day.